Greetings and salutations, everyone. Welcome back to Spine and Sports Therapy Kingwood. Today we're going to be talking about some postures, specifically standing posture, and different things that you can do to fix standing posture. But before we jump into today's topic, I want to recap some of the things we've talked about previously and bring this whole conversation back in context. So this originally started off with a conversation about injury prevention. So we talked about a whole slew of risk factors, things that predispose you to injury. And we specifically identified several different underlying topics, 6 of them specifically, that are very addressable, things that you can do, that you have the power to address and fix. And when you do that, you substantially reduce your chance for injury. So posture fell underneath one of those, is one of the main subtopics as far as risk factors for injury that you can address. So if you're interested in more about that and want to get that overarching topic of how we got into what we're talking about now, then check out my video on this channel about risk factors that you can address. So anyway, back to posture. So within the subcontext, the subheading of postures, there are 3 main postures that if we fix, then we substantially reduce our chance for injury. Posture, specifically poor posture, is a substantial or a significant risk factor. It can place a ton of extra excessive mechanical stress on all our joints, our spine, and our muscles as well. So if you're able to fix postures and reduce that stress and strain that we add on ourselves on a daily basis, we can really prevent our chance of new injury, re-injury, or chronic pain states. So that's what this is all about. So there are 3 types of postures that we're working on: sleep, standing, and sitting. So I've made a video on sleep postures. Go ahead and check that out as well. But today we're going to be talking about standing posture. Now there are really 5 main topics in standing posture that we need to talk about: ankles, pelvis, hips, low back. Then we have to talk about shoulder blades, shoulders, and then neck as well. But we're today going to be focusing on pelvis, hips, low back, and then ankles, essentially. Basically our lower half is what we're going to be talking about today. So we'll jump right into it. We're going to start here with our pelvis, hips, and low back, essentially the core. Now, if this gets fixed, it actually will fix a lot of other postures. It'll fix the rest of the lower extremities, and it can help fix our mid-back, our shoulders and shoulder blades, and our neck as well. So fixing this first is the main key. The other things are important as well, but this is the one thing that if we fix our core posture, then that it'll help to fix all these other things. So we'll go ahead and dive right into it. I'm going to stand up and show you two common poor postures, and then the ideal posture of what we're looking for, and kind of how to get into it. So I'll go ahead and stand. I'm cutting off the top half of my body, but so that we can focus on my core here. So a couple main postural positions we get into in a standing position. This first one is what I call the pregnant type posture, where there's a big arch in the small of the back and a big curve in the stomach, in the belly. So that's a really common posture when we stand, and it can wreak havoc on our low back, our pelvis, our hips. Our core muscles are completely turned off. Our glute muscles are turned off. So the weight of our upper body is being supported by our low back joints, the joints and the discs, and that's an unhealthy, unnecessary amount of stress and strain for them to take on. Another common posture, not as common as this first one, but somewhat common, is this position. It's a really excessively, almost slouched low back position, with the hips tucked under, and the hips rounded forwards. So both of these are not ideal positions. The first one, like I mentioned, puts a lot of stress in the low back, a lot of stress in the pelvis and hips. The second one, because of that position, it puts all of the stress in the heels. So there's an excessive amount of pressure going into the heels, and subsequently into the knees, and subsequently even up into the low back. When our standing weight is exclusively in our heels, we're not taking advantage of the arch muscles, the arch system in our foot. There are actually 3 arches on our foot. We always usually think of just the inner arch being the arch, but there's an arch across the ball of the foot, and there's an arch on the outer part of the foot as well. All 3 of those arches being used appropriately can dramatically help shock absorb pressure that we're taking on, and that's why it can play a really big role in reducing stress and strain into the entire lower extremities all the way up to the low back. So here's how we fix this. So again, here's the low back. This is my Goldilocks analogy. This is too hot, this is too cold, so this is just right. So finding what we call neutral position, a neutral core position or a neutral low back position. So one of the easiest ways to do this is take your hands, place them on your hips, and roll into both these positions. Roll those pelvis and hips forwards and backwards like this. It's simply my pelvis and my hips and my low back moving. I'm not moving my upper body, I'm not bending my knees. After you do this a few times, feel both edges of the extremes and then simply find middle. So this is too hot, this is too cold, and this is just right. So rocking forwards all the way, rocking backwards all the way with the pelvis and hips. Sometimes I think about as if you're grabbing a bucket and tipping the bucket forward and then tipping the bucket backwards. Go to each end range in each direction and then simply find middle. This is what I call calibrating your core. You go all the way one way, all the way the other way, and then you find that middle area. That middle area is the neutral position. You should feel less tension in your muscles and your joints in this middle area than both the other 2 extremes. Both the other 2 extremes, you feel tension in your low back or tension and stretching in your muscles. And what we want, that neutral position reduces the excessive pressure in the discs and the joints, and it also incorporates the core muscles, the glute muscles, into helping support your spine, your pelvis, and your hips. When those muscles are engaged, they help take some of the stress from your pelvis and hips. So that's a simple little fix. This is something that's not doesn't happen right away. It takes a little bit of body awareness. So as you're standing in line at the grocery store waiting to pay, thinking about, hey, where's my low back? Is it neutral? Is it too hot? Or is it too cold? Or is it in the middle? But doing this for simply a week, you'll notice a dramatic change in your body's own central positioning system. So you'll create a new normal essentially after doing this for as little as a week sometimes, depending on how much you do it. And that's the end goal with these type of body awareness techniques is you become aware of what your baseline is, and then you do some of these corrections for a relatively short amount of time, and then you establish a new normal. You establish a new baseline for your neuromuscular system, your brain-muscle connections. And that's the goal here. So this doesn't have to be something you do for the rest of your life. It's something you do now, often, and it self-corrects over time. That's the biggest one. That's one of the most important ones. I will touch on the feet right now as well, because that's an important aspect of the lower extremities. So get the core fixed first, but then here's another tidbit with the feet. So when we stand with this posture, like I showed you in the beginning, that slouch position, if you drew a line straight from my butt down to the ground, you can see how my center of mass, my center of gravity, is behind me. And therefore, all of my weight is in my heels. Like I mentioned, all of the pressure and weight going into the heels puts an excessive amount of pressure into the heels, the knees, the hips, the low back, and you're not utilizing your arch system. So the simple fix for this is moving your feet back so that your center of mass and center of gravity is right underneath the middle of your foot. Right in the middle of the foot, so your arch system can begin to be utilized. And when it's utilized, then it distributes the pressure, distributes the stress more evenly, and you don't take on as much stress into your heels, knees, hips, low back. So, like I said, fixing the low back and the core will actually help fix this as well. But something to take notice of: stand for 30 seconds and feel where the pressure is. Do it barefoot. Feel where you're feeling the pressure. Are you feeling a lot in your heels? If you are, then simply move your feet backwards so that your center of mass, center of gravity is right underneath your feet. This is the main correction here. Most people don't do the reverse. Most people don't do the Michael Jackson lean and have too much pressure in their forefoot or in their toe region. Most people do the opposite. Most people have their weight back in their heels, and they have all their weight in their heels. So the main fix for that is moving those feet backwards, and you'll feel the pressure go into the ball of the foot or the middle of the foot, and those different areas. That helps to activate that arch system and can really decrease the stress from going straight into your joints. So that's the two main fixes for core, pelvis, hips, low back. I consider that all one thing. That's the core essentially. And then the feet as well, your feet positioning. Get your feet positioning right and your low back positioning right, and you're going to be off to a great start to fixing your standing posture. So that's it for today. Stay tuned. There's going to be a follow-up video to this one about standing posture for mid-back, shoulders, and head, neck. Those things as well. But thanks so much for checking out the video. Go ahead and hit that subscribe button. Tons of other awesome videos about mobility, stability, injury prevention, sports medicine in general. So hope you guys enjoy this. Leave a comment if you have a question or a comment for troubleshooting some of this stuff. But thanks so much. Have a great rest of your day. It's Dr. B signing off.